Welcome to Study Nurse IQ. Today we're exploring chronic obstructive pulmonary disease, commonly known as COPD, a progressive respiratory condition that affects millions worldwide. COPD is characterized by persistent airflow limitation and breathing difficulties that significantly impact a person's quality of life. Understanding this condition is crucial for healthcare providers as it's one of the leading causes of morbidity and mortality globally. COPD encompasses two main conditions, emphysema and chronic bronchitis, each with distinct pathological changes in the lungs. In emphysema, there's destruction of the alveolar walls, leading to enlarged air spaces and reduced surface area for gas exchange. Chronic bronchitis, on the other hand, involves inflammation and excessive mucus production in the bronchial tubes, causing persistent cough and airway obstruction. These conditions often coexist, creating a complex clinical picture that requires comprehensive management. The pathophysiology of COPD involves several key mechanisms that contribute to airflow limitation. Chronic inflammation leads to structural changes in the airways, including thickening of airway walls and increased mucus production. The destruction of lung tissue reduces elastic recoil, while smooth muscle contraction causes bronchial constriction. These changes result in air trapping and hyperinflation of the lungs, making it progressively harder for patients to breathe effectively. Risk factors for COPD are numerous, with smoking being the primary culprit in developed countries. Long-term exposure to tobacco smoke, including secondhand smoke, significantly increases the risk of developing COPD. Environmental factors such as air pollution, occupational dust, and chemical fumes also contribute to the disease's development. Genetic factors, particularly alpha-1 antitrypsin deficiency, can predispose individuals to early-onset COPD. The classic symptoms of COPD include chronic cough, often described as a smoker's cough, excessive sputum production, and progressive dyspnea, especially during physical activity. Patients may also experience wheezing, chest tightness, and frequent respiratory infections. As the disease progresses, symptoms become more severe, and patients may develop complications such as cor pulmonale and respiratory failure. Diagnosis of COPD relies heavily on spirometry, which measures lung function and airflow limitation. The key diagnostic criteria include a post-bronchodilator FEV1-FVC ratio less than 0.70, indicating persistent airflow limitation. Additional testing may include chest X-rays, CT scans, and blood gas analysis to assess disease severity and identify complications. Early diagnosis is crucial for implementing effective management strategies and slowing disease progression. Treatment approaches for COPD focus on symptom management and preventing exacerbations. Bronchodilators, including both short-acting and long-acting medications, are the cornerstone of pharmacological therapy. These medications help relax airway, smooth muscles, and improve airflow. Inhaled corticosteroids may be added for patients with frequent exacerbations or significant symptoms despite optimal bronchodilator therapy. Nursing care for COPD patients involves comprehensive assessment and monitoring of respiratory status. Regular evaluation of breath sounds, respiratory rate, and oxygen saturation helps identify changes in condition early. Nurses play a crucial role in medication administration, particularly ensuring proper inhaler technique. Teaching patients proper breathing exercises and energy conservation techniques is also essential for managing daily activities. Patient education is a fundamental aspect of COPD management. Teaching topics should include smoking cessation strategies, proper inhaler technique, and recognition of exacerbation symptoms. Patients need to understand the importance of regular exercise within their limitations and maintaining proper nutrition. Education about avoiding triggers and managing stress is also crucial for preventing exacerbations. Pulmonary rehabilitation programs are valuable interventions for COPD patients. These programs combine exercise training, education, and psychosocial support to improve patients' functional capacity and quality of life. Exercise training helps build endurance and strength, while education sessions provide strategies for managing symptoms and preventing complications. Oxygen therapy is often necessary for patients with severe COPD and chronic hypoxemia. Understanding proper oxygen administration, including flow rates and delivery devices, is crucial for healthcare providers. Patients using home oxygen need comprehensive education about safety precautions and proper equipment maintenance. Prevention of exacerbations is a key goal in COPD management. This includes regular vaccinations against influenza and pneumococcal disease, prompt treatment of respiratory infections, and avoiding environmental triggers. Patients should maintain an action plan for managing worsening symptoms and know when to seek medical attention. Nutritional support is essential for COPD patients, as many experience unintended weight loss and muscle wasting. A balanced diet rich in proteins and nutrients helps maintain muscle strength and supports immune function. Some patients may benefit from nutritional supplements to meet their increased energy requirements. Psychological support is often overlooked but crucial for COPD patients. The chronic nature of the disease can lead to anxiety and depression, affecting quality of life and treatment adherence. Healthcare providers should assess patients' mental health regularly and provide appropriate referrals for counseling or support groups. End-of-life care discussions are important for patients with COPD. Quality of life considerations should guide COPD management strategies. This includes helping patients maintain independence in daily activities, supporting social connections, and addressing sleep disturbances common in COPD. Occupational therapy referrals may help patients adapt their environment and routines to conserve energy. Research in COPD management continues to evolve, with new treatment options and management strategies emerging. Healthcare providers should stay updated on current guidelines and evidence-based practices. Understanding new developments in pharmacological treatments and therapeutic approaches helps provide optimal care for COPD patients. The role of technology in COPD management is expanding, with innovations like smart inhalers and remote monitoring systems. These tools can help track medication adherence, monitor symptoms, and facilitate early intervention when needed. Healthcare providers should familiarize themselves with available technology to support patient care effectively. All right, it's time to test your knowledge with a few NCLEX-style questions. Let's see how you do. Question 1. A nurse is caring for a patient with emphysema. The patient has a respiratory rate of 28 and is in a tripod position. The nurse understands these findings are a result of which of the following? A. Increased oxygen levels in the blood. B. Air trapping and hyperinflation of the lungs. C. A sudden decrease in blood pressure. D. A productive cough with thick sputum. Correct answer B. Air trapping and hyperinflation of the lungs. Rationale. Emphysema causes the alveoli to lose elasticity, leading to hyperinflation and air trapping. This makes it difficult for the patient to exhale, causing dyspnea and leading them to use accessory muscles and the tripod position to facilitate breathing. Question 2. The nurse is providing patient teaching for a client with newly diagnosed COPD. Which of the following statements by the client indicates a need for further teaching? A. I need to eat small meals throughout the day to help me breathe. B. I should blow into my incentive spirometer to expand my lungs. C. I will place a no smoking sign on my front door. D. I will try to stop smoking to help my condition. Correct answer B. I should blow into my incentive spirometer to expand my lungs. Rationale. The patient should be taught to inhale deeply into the incentive spirometer to open their lungs, not blow into it. This statement indicates a need for correction and further teaching. Question 3. A client with a history of COPD is admitted to the hospital. The nurse assesses the client's hands and notes a bulging of the fingertips and a downward curvature of the nails. The nurse would document this finding as ACE, B. Pursed lip breathing, barrel chest, clubbing. Correct answer, clubbing. Rationale. Clubbing is a physical sign of chronic hypoxia, which is common in patients with COPD. It presents as an enlargement of the fingertips and a downward, spoon-like curvature of the nails. Great job on the quiz. I hope this video has helped you feel more confident about caring for patients with COPD. Remember to like, comment, and subscribe for more nursing content on YouTube. Thanks for watching Study Nurse IQ.